So I'd like to thank everyone thank you all for coming to this, the virtual provider panel session. It's part of the GSU Prevention Research Center Connecting Behavioral Science to COVID-19 Vaccine Demand grant, which was part of the CDC Vaccine Confidence Network. And before we start off, would like to advise everyone to please make sure you're muted. That way, all our speakers get to share their perspective on this. And we want to give everyone the opportunity afterwards to ask questions. So please use the chat box just throughout the conversations. Just use the chat box and type in your questions, and we will make sure to ask them. The session is being recorded if you haven't seen the message already pop up on your screen. And it'll be available to participants through the school. So individuals who were not able to attend today, they will hopefully have access to this. So first, I want to start off by asking the panelists to introduce themselves and just say a few words about the work they've been doing thus far surrounding like COVID and important issues related to COVID-19 in children, as well as the vaccines.
Sure. Who would you like to go first, Khadija? Should I start?
Sure, go ahead.
My name is Susan Reinus. First of all, thank you very much for inviting me to be a part of this panel. I am a pediatrician. I work for Kaiser Permanente, and for many years, I worked with the refugee community in the refugee clinic at DeKalb County Board of Health. My work with COVID-19 has been completely clinical. I've personally cared for many children, but for many patients, both face-to-face and virtually with COVID. And I've also been involved with some of our organizational planning with COVID testing and vaccine administration in our facilities. I think the most important issues related to COVID-19 for me continue to be vaccine hesitancy, really in every age group, for the 5 to 11-year-olds, for the teens, and even still the adults that I meet. There's continued dissemination of misinformation around vaccines, and the vaccine and COVID has been highly politicized. In addition, I think too many children and teens are still doing virtual school because of parental fear of the virus and the vaccines. And the virus continues to take a mental health toll on our children and our families. We're still seeing lots of depression, lots of anxiety related to isolation, not being in school.
Thank you for that. Dr. Veda, you can go next.
Yeah, so long as I don't freeze. Good evening, everyone. And again, I have to thank you all for allowing me to also participate in this wonderful panel. Whenever I have the opportunity to talk to families and communities around the issues that we're facing, not only for COVID, but just, all the issues around health disparities that really are prominent in our refugee community, as well as the underserved community that I care for. It's always wonderful to have opportunity to listen to your questions, to try to answer them, and to give you some consolation and some comfort around some of the issues that affect you. So I'm a pediatrician also, and I am a professor of pediatrics at Emory University School of Medicine. I have been involved with schools for the past 30 some odd years because my main focus is increasing access to healthcare and also improving the delivery of healthcare for children in schools so as to maximize academic achievement. In terms of my involvement with COVID, it is diverse. I have been involved on an administrative level, where I've been trying to set up systems where testing is more available, where vaccines are more available, primarily in the schools. And I've also, as a pediatrician, have cared for patients and families affected by COVID. I have personally been affected by COVID, in that this past holiday season, the vast majority of my children contracted COVID, even though they were vaccinated. And due to the fact that they were vaccinated, their course was a lot milder, and they really weren't subjected to any type of severe consequences from COVID. So as Susan has said, as pediatricians, vaccine hesitancy not only for COVID, but essentially every vaccine these days is at the forefront of our concern. And anytime we have the opportunity to ameliorate your fears and your concerns, that's an honor for us. So I look forward to the questions and look forward to being able to discuss this in a way that's really meaningful to you.
Thank you so much, Dr. Veda, for sharing that with us. Now I would like to hear from Reverend Kimani.
Hello, everyone. My name is Reverend Kimani Francois. I am actually a pastor at Peachtree Baptist Church, and I'm also a Faith in the Vaccine ambassador through the Office of Spiritual and Religious Life at Emory University and through Interfaith Youth Corps. Some of the work that I've been able to do around just vaccine access took place last summer when Peachtree Baptist Justice Initiative was able to focus on health equity. And we partnered with Emory Healthcare to bring 2 mobile vaccine clinics to the Toco Hills community, and where, over 70 people were vaccinated. And so we were super excited about that work being done. But I'm so excited and thankful to be here with you all tonight. I've spent a good amount of time in the Clarkston area working with Inspiritus. And so I'm just happy to be speaking to you all tonight, just kind of about, what the work I've been doing, but also just faith leaders and the conversations that are taking place in churches, but also spiritual communities around vaccine access, vaccine hesitancy, building curriculums, recruiting volunteers and outreach. And so thank you all for having me tonight.
All right, thank you so much, Reverend Kimani. So I believe now is when we'll move on to the questions about Omicron, which is the one that there's a lot of confusion around it, and a lot of questions about that and about vaccines, and why some parents are resisting the vaccine. People are already resisting the adult vaccine altogether, but now there's the vaccines for children. So we just compiled a few questions, more than a few questions, that are popular within the community, and we believe that people have been asking them all around. So the first one is, what is Omicron and what makes it different from the Delta variant?
Okay, I'll go ahead and start with that. So Omicron is the most recent variant of the coronavirus that is causing our current surge, and it currently accounts for about 99% of new cases in the United States, and it is quickly spreading all around the world. There's several differences from Delta, and I can go through these. First, I think everyone is aware it's much more contagious than Delta was, and it is much more easily transmissible than some of the earlier variants, and that's why it's spreading so quickly through our population. It also seems to have a shorter incubation period, and incubation period is the time that elapses between exposure to a virus and when somebody I'm sorry, I was muted. I'm not sure what was heard. So it's more contagious. I think probably everyone heard that. And the incubation period is going to be shorter. With Omicron, it's about 2 to 3 days versus with Delta, it's typically about 4 to 5 days. Also, and this is something that's very positive, Omicron does seem to cause less severe disease, and fewer people do need to be hospitalized or need ICU care compared to the Delta virus. There are some studies that show that Omicron is less likely to infect the lungs than Delta was. And the majority of people are going to have more upper respiratory symptoms similar to a common cold or a flu than lower respiratory symptoms like bronchitis or pneumonia. But this is not always the case. And we know that there are some people who are going to have pretty severe disease, And there are the United States, the hospitals in the United States are filled currently with many people who have Omicron, and we're still seeing many, many deaths every single day due to Omicron. I think the numbers now are about 2,000 a day. We know that with Omicron, and this is another difference, there's more breakthrough infections with this strain, even in people who have been vaccinated. And the current vaccines are not as good at completely preventing infection. But that being said, and I really want to emphasize this point, the vaccine is still very, very effective, about 90% effective in preventing severe illness and hospitalization from this strain. Pfizer has announced that they're working on another vaccine specific for Omicron, and we should be hearing results of those studies soon. And let's see, one other difference is that it seems like antibodies that are produced after natural infection with Omicron are protective against the Delta infection, which is very interesting. People who had Delta and have produced antibodies to Delta were not necessarily protected against Omicron. So there's several differences between the two strains. And I'll let Veda add anything else.
And Susan, you did a great job. I don't know if there's anything else for me to add, other than what I think is really important, because everyone's been asking the question, why is it so much more contagious than Delta? And it's because we think it's airborne, in addition to the fact that it's so easily transmitted and it seems to attach to the respiratory system a lot quicker. But they think it's airborne because, we had that discussion early on with Delta. Is it airborne or is it droplets? How close do you need to get to a person in order to contract it? Is wearing a mask, enough to prevent it from happening, washing your hands and doing social distancing? And we know that we're continuing to do those things, trying to stay, well, as best we can, trying to stay 3 to 6 feet away from each other. We're not wearing our masks like we used to, but clearly that's an issue. But we do think that it is more airborne than the Delta variant was. So that makes it a little more easier for you to be exposed to it. Say if somebody walks in an area, sneezes, walks out of that area, you can actually walk into that area and be subjected to contracting the virus. The other thing I think is really interesting is how it presents. Because you remember, the Delta variant presented with a loss of smell, a loss of taste, but it actually doesn't happen as often with Omicron. Fever and sore throat are the main presenting factors. And we have fever and sore throats in children all the time. And so it's really difficult to discern as to whether this is a regular, a virus that's causing, another virus causing the sore throat, or strep causing the sore throat, or Omicron causing the sore throat. But I think that's really important. I think the other important aspect of when it comes to vaccinations is that children who are vaccinated against Omicron and all of the coronaviruses are less likely to suffer a lot of the sequelae, like the multi-system inflammatory disorder in children and also long COVID. So not much more to add. Susan did a great job, but to know that it is probably airborne. And so you really need to concentrate on wearing your mask and stand 3 to 6 feet apart from people, especially in areas where you have high volumes of people, and also to continue to wash your hands.
All right, thank you. I feel like I learned a lot. That was very informative. But if you caught Delta, then the antibodies do not protect you from the Omicron. I had no idea. Since Dr. Veda, since you already mentioned the symptoms of Omicron, right? Like what is the most prominent ones? People do confuse the symptoms of Omicron to a flu and a cold. So what would you suggest? When do you suggest they get tested? Because sometimes they either test too late or they don't test at all and they're still going out, interacting with family members, with going to school, going to work and all that. So when do you suggest they get tested and what should they do?
Are you referring to me?
Yes.
Yeah, I keep freezing. I just want to make sure that I don't freeze mid-sentence. So in children, like I said, the presenting symptoms are fever and sore throat. I had a nephew this past Sunday who's my niece called me and told me that her son was sick and he presented with a sore throat and fever and fatigue. and wanted to know, should he be tested? And I said, yes. Normally, I would say no, in any other situation, because it's such a common presenting symptoms for children, especially during the winter months, because, the prevalence of other viruses. But she tested him and he was positive. This has been a real challenge for us as pediatricians, how to counsel our families on when to think COVID and not other things. I don't know if I can. I'll let Susan comment give you her perspective, because COVID is so prevalent and is so necessary to identify it and to isolate children and anyone as soon as possible. I just strongly recommend that you test for it, even when you have symptoms that would normally be caused by something else. Other symptoms that we see in children is a lot of sort of abdominal presentations, such as nausea and vomiting and stomach pain. And of course, if they are really, if you're really concerned about children having a significant response to COVID, they usually present with a little more critical symptomology, such as difficulty breathing, color changes, extreme fatigue. Sometimes they will present with the inability to wake up or difficulty waking up. But any of those symptoms are really a signal that you need to get your child to the hospital as soon as possible. But the vast majority of children, and I mean the vast majority of children, present with very few symptoms and that resolve very quickly. But again, COVID should be at the top of your list these days, because that's the most prevalent in our community.
Yeah, I completely agree with everything that you said. I think even the most astute clinicians have a lot of difficulty telling this apart from anything else. And I think that if you have symptoms of even what seems like a mild upper respiratory infection or cold, the prudent thing to do is to get tested for COVID, and either with a home test or a PCR test. And it can be very difficult to find tests now. And there are very long lines for tests. And so if somebody is unable to get a test, I think assuming COVID and isolating, staying home from school, staying home from work until you can be tested is very important. Hopefully, we'll all be having, some of the home tests will become more available to us very soon when we start receiving those from the government. I know that it's hit or miss when you go into a pharmacy whether or not tests would be available. But I do recommend, if people can keep a couple of tests in their home, you don't want to be a hoarder, but if you can keep a few tests in your home, I think that's always going to be helpful.
Yeah, for sure. Thank you. Thank you for that. I have family members that tested positive, and their child had like symptoms too, but they weren't sure if it was. And it was actually the child that brought it into the home. So they weren't necessarily sure, and then they all tested pretty late. So one thing is, speaking of, individuals and households testing positive, what precautions would you suggest that one takes to protect themselves from a family member, or protect their family from a family member in the same household that tested positive?
Yeah, so I think that's really tough, and it really depends on who is the infected individual in the home. I think it can be relatively easy for an infected adult or a teen to isolate themselves, harder for a school-age child, pretty much impossible for a toddler or an infant. They just can't do it. So if you have an infected teenager and they have their own room, or you can create their own room during this illness, I think it is best that they stay in their own room as much as possible. And when they're around other family members, they should always mask, and their family members should mask as well. If the infected adult is the sole parent, they obviously can't just stay in their room. And so when they prepare meals, if they're well enough to prepare meals and still take care of the children, I think the adult should be masking, and children over the age of 2 in the household, we would recommend masking. But it can be very difficult when individuals live in a small apartment. Children are sharing bedrooms. There may just not be any place for people to go. And I think we should just encourage families to do the very best they can, wear masks, try to distance, wash their hands well, isolate in the home. And again, remind everybody to get vaccinated when they're feeling better. And for those who are vaccinated and unboosted, go ahead and get boosted.
All right, thank you. And then how about, the CDC recently changed the guidelines for isolation. And it was like 5 days if you are vaccinated, and then spend the other 5 days wearing a mask. But if a child does test positive, and they're not vaccinated, does the 5 days apply to them too, or do they need to isolate for the full 10?
So if, Veda, did you want to take that one, or do you want me to go on?
Wait, you can go on. You just
okay.
actually froze when you were talking.
I didn't see your name, so I wasn't sure that if you were there.
Mm-hmm.
So if a child tests positive and the illness is mild, and well, it really depends on the age of the child. So we're going to be talking about, well, let me step back for a second. If the child tests positive, if they are well at 5 days and they are able to strictly wear a mask after that 5-day period, I think it's okay for that child to leave the home and to return to their activities, provided they can strictly wear a mask. So children under the age of 2 clearly can't, and we would recommend a full 10-day isolation for those children. And from my own patients, I don't really think that children under the age of 5 can strictly adhere to mask wearing through the day. And I would recommend that really all children 5 and under go ahead and isolate for a full 10 days. I think over the age of 5, it really is going to depend on what the other activities are, where the child is going to go, and whether they can continue to mask. If somebody is not well at day 5, they should not come out of isolation. And so I think the CDC says fever-free for at least 24 hours, and symptoms have to be improving. And I typically tell my patients they have to be well. And fortunately, most of them are well at the end of 5 days. Does that answer the question?
Right.
Yeah.
So I just wanted to add, so for school districts, that's hard to make that distinction, in that, based on age. And I think most school districts would adhere to the fact that if you test positive and you're not vaccinated, then you need to isolate for 10 days. But, being practical and understanding the pathophysiology and what's happening, we know that children can actually, come out and resume their activities after 5 or so. But I do think school districts are really struggling with trying to educate the population about all the different caveats around when you can and cannot. So I think in general, if you are unvaccinated and you test positive, then you probably need to isolate for 10 days.
I would also add that a lot of parents that I see are getting their children retested at day 7, at day 10,
Right.
and thinking that they need a negative retest in order to return to activities. And that's not actually true. So we think that transmission in most cases is going to end day 5, day 6, certainly by day 10. And so children can return to school after the 10 days without having a negative test. The PCR test can remain positive, we know, for several weeks to months after a COVID infection. Right. And that, I think, is an important take-home point for parents.
And yeah, there was a question in the chat that asked if you test positive and then you use the rapid antigen, I think that's what they were referring to, after day 5 and test positive. Is it safe to go out then? Probably not. I would adhere to basically, the guidelines that say you need to isolate for 10 days, because like you said, you can test positive for a very long time.
And one other point that I think is important with the rapid antigen tests is they were never evaluated to determine how long someone is going to be contagious and whether they are reliable in terms of discontinuing isolation. And that is one of the reasons that the CDC did not require a negative antigen test to come out of isolation.
Right.
All right, thank you so much, Dr. Susan and Dr. Veda. Next, we will give Reverend Kimani the floor, hear her wisdom about discussions going on in faith-based spaces around the vaccine and around COVID.
Thank you, Khadijah. Hello, everyone. As I mentioned before, I am Reverend Kimani Francois, and I am also a faith in the vaccine ambassador through Interfaith Youth Corps. And so I really want to kind of give a little bit of a snippet of what Interfaith Youth Corps does, but also how our Justice Initiative was able to connect and other faith-based kind of spaces and the conversation that's happening within the Atlanta metropolitan area. And we are actually a part of sponsoring this mobile vaccine clinics that are coming to Indian Creek. So we're super excited to be partnering, but also to be active in the community. So a little bit about Interfaith Youth Corps. So they have, it's a organization out of Chicago, and they've partnered with universities across the country for this Faith in the Vaccine project, which I said, I had to get behind it. And I had 2 teammates, and we were able to bring together kind of an interfaith community to bring the mobile vaccine clinics to our Toco Hills community area. And so we were able to be trained. We were able to be connectors with healthcare providers and also other faith leaders and institutions, which was super critical in answering questions and, referring to the CDC, referring to doctors with information, as Dr. Susan and Dr. Johnson has just kind of just expressed. And so that's what we were able to do. But I'm also a part of a church context, a Baptist church in Atlanta, where we were able to, where within our own community context, we were able to do 2 things. Provide education and information from the pulpit, but also provide access and space for other faith-based communities to come and say, we will host mobile vaccine clinics here, but also we want to provide correct information when our members and congregants have questions about it and fears about their children receiving the vaccine that are legitimate. And so that's kind of where we work. And so some things that we've been running into with education and information, we've gone back and forth between in-person worship and virtual worship, just to make sure that we're protecting as we listen and as we see CDC recommendations, we are being safe with that. Also encouraging our congregants when they're in person to wear masks and stay socially distanced and wash their hands. That's something that we are actively doing, specifically in my context. And then access to space, as I mentioned before, hosting mobile vaccine clinics, encouraging it, partnering up with healthcare providers so that those who do the work are there, and we're just simply influencers and talking about why it's important to get and receive the vaccine. And lastly, recruiting people to volunteer and help, get through this, because this is a very, as people have been saying, unprecedented times. And so those are kind of the things and the discussions and the actions that have been taking place around my particular context, but beyond that, the interfaith work that's going on in the Atlanta area with mobile vaccine clinics, and also just encouraging to just stay educated about it. That's what we've been doing. And so it's been an exciting just process to see, and but also we're just staying very present. And so, yeah, that's just kind of a spill of what we've been able to do over the last 6 to 7 months, and we hope to continue it.
All right, thank you so much, Reverend Kimani. I really appreciate that. I appreciate the work that you've all been doing and continue to do for the community. So next up, we will move on to questions about the vaccine, right? The most, I guess the most popular questions that people do have. This one is, I believe I'll direct it to Dr. Johnson. Is the a vaccine for children, is it an injection or is it taken orally? And how many doses or shots do kids' vaccines require?
So the vaccine is injected like all other vaccines for the most part, except for one of the vaccines we give little ones, within the first 6 months. And like with adults, it's a 2-dose vaccine given 3 weeks apart, and a booster, like adults, given, we say, 5 to 6 months after the second dose. What we found, though, with the vaccine, what most people don't recognize, that for children under the age of 12, the vaccine dose is half of that of adults, right? And so in some ways, you consider that to be a little bit safer than the dose that you actually give for adults, even though the dose for adults are safe as well. But you get half the amount of vaccinate in your shot. And that means also that your reactions are going to be less than what you see with adults. But we have found that children after the second dose, like with adults, uh-oh, can you hear me? All right,
Yeah.
that children,
Yes.
yeah, okay, that you have, a few more, exaggerated responses as far as, pain at the site of injection. You may be a little more fatigued, and you may just be, have more headaches when you have after the second dose. But it has been my experience, and Susan can comment to this as well, that children tolerate it extremely well. And that I've seen very, very few side effects when we give this to children. Over the past few months, I've been really surprised, over the past month or so, the number of parents who are willing to give the vaccines to their 5-year-olds. And I've been very pleased by that, because I thought we'd have a lot of resistance because of the fears around the safety and the efficacy of the vaccines. But they are extremely safe, and they're extremely efficacious. And so, again, as a pediatrician, I just strongly recommend that our parents consider this, because this is really a great protective factor for our children. And as Susan said, among all the other issues that affect our children as a result of COVID, not being in school is probably the most significant. And we want to do all we can to keep children in school and to keep everyone in the school healthy. So I strongly recommend, and I'm willing to answer any other questions that parents may have.
Yeah. And I'll just add that, at this point, millions of children between the ages of 5 and 11 have been immunized. And so we have a lot of data about this vaccine in a relatively short period of time. And the vaccine is proving to be extremely safe. Occasionally, a parent may say to me, my child has a heart problem, or at birth they had a heart problem, and I'm just not sure about this vaccine, because it did, for some of the adolescents, there were a few cases, and I want to emphasize that it was only a few cases of an inflammatory problem in the heart. But this has been seen even more rarely in the youngest children. And I think to date, there have been about 12 cases in all of the millions of children who have received this vaccine. And sometimes parents will say, well, people have died from this vaccine. And to my knowledge, this is misinformation. There have been no deaths in children related to this vaccine. Veda, can you confirm that?
Absolutely.
Yes.
Absolutely. As far as the data that I've seen.
And I know that there are posts on Facebook and other social media sites that have talked about that, but there have been no deaths in children.
Absolutely.
Well, that's really good news. It's good to hear. So the next thing is, so for children who did have COVID in the past, right? So some parents are saying, they are immune, they don't need to get vaccinated. They just, they had it, they recovered, they're fine. There wasn't any severe illness. So what would you say to that? How important is it for the children to still get vaccinated?
So I would say that it's still very important for the children to get vaccinated. It is true that a child or an adult that has COVID likely won't get the same strain of COVID in the next 3 months. So it does offer, having natural infection is going to give somebody some short-term protection, but we think that infection is going to wane or decrease over time, just the same way that antibodies to the vaccine will wane or decrease over time. And there are going to be new strains that pop up as well. I mentioned initially that having immunity to Delta did not protect people from getting the Omicron strain, right? So there were still breakthrough infections. So we still recommend immunization, even if someone has had natural infection. And there is no specific, there are very few cases where you have to wait in order to vaccinate. So the current recommendations are with a mild infection, once an individual is outside of their isolation period and is completely well, it is safe to give that child or an adult a vaccine. There are rare cases where you would wait 90 days, 3 months to immunize, and that would be if a child was hospitalized with a very severe condition or somebody received monoclonal antibodies. But in all of the other cases, vaccine can be given once somebody is out of isolation and is free of symptoms.
And also to add to that, there's no evidence that natural immunity is better than vaccinations, right? And we know that people who have been vaccinated are contracting the Omicron variant, right? Because everyone in my family who contracted COVID over Christmas were all vaccinated. Not only were they all vaccinated, but they rarely went out and they were always masked and they always adhered to the protocols. So we know that just because you contracted COVID and have some natural immunity, there's a pretty high possibility that you will actually contract it again if you don't have additional immunity from your vaccination.
All right, thank you. Next, we have what advice can you, Dr. Johnson and Dr. Reines, give people or parents who feel that children are resilient and that COVID can't affect them? Because, in the past, they get sick, they'll get the, they'll get the flu and other illnesses and they just recover. Kids are resilient. They're always building immunity to things. That's how their immune system gets stronger. Right. So what advice would you give?
Well, children are resilient. That's a correct statement. However, they're not immune to serious illness, right? They're not immune to, let me just say this. There's a lot about COVID that we don't know. We have no idea what the long-term consequences of COVID are, right? We didn't realize until fairly late, well, in terms of when the virus actually came on the scene, that children who have been exposed to COVID with very few symptoms, 4 to 6 weeks later develop MISC, the Multi-Inflammatory Syndrome that's very, very serious in children. It requires about 90% of them to be hospitalized and over half of those to go to the ICU, right? And these children had absolutely almost no symptoms, right? Or had very mild, and sometimes didn't even know they had been exposed to COVID. So we really don't know what the long-term sequelae or consequences of COVID are, right? And even though children are resilient, they are not immune to significant illness from COVID or any other disorder for that matter. So I wouldn't sort of frame it in the context that children are exposed to a lot of things, they get over a lot of things. I would say, let's prevent our children from any possibility that they can contract something that would cause them long-term harm, right? And just be safe and cautious for our children. And let's help prevent the possibilities that they'll be subjected to something that's really going to cause them a lot of harm down the road.
Yes, I completely agree. And I think that you looking at some of the numbers, I think helps to tell the story or emphasize the point that this is not benign. So in the United States, over 35,000 kids have been hospitalized with infection and 800 children have died. In Georgia, there have been 3,000 hospitalizations in children and 25 deaths. So this is serious for kids. This is definitely serious. Dr. Johnson already talked about MISC, but MISC is not that rare. As a pediatrician working in my office, I saw 5 children who had MISC over the course of a year and a half, who all needed to be hospitalized. That's significant for one pediatrician, and my partners also saw cases. There have been some recent studies that also are showing that children who have COVID infection have a higher risk of developing diabetes in the months after a COVID infection. That is a very serious and lifelong illness. And then the last point I want to make about this is that children are vectors of this infection. Even if they get over it, they may be transmitting it to somebody who is more vulnerable. And it's not just older people, but sometimes younger adults, have had very serious infection, and pregnant women. So if a child brings this home to his mom or her mom that is pregnant, that is not vaccinated, that mom is likely to have, is more likely than somebody who's not vaccinated having complications from COVID. There's a higher rate of stillbirths as well in pregnant women who develop COVID during their pregnancy. So it's not a benign illness, and we should be protecting our children. They are resilient, I completely agree, but they're not immune from serious complications or from passing it on to others.
All right, perfect. Thank you. Thank you both for sharing that. The next question would be for Principal Bibi. Can the school provide vaccines for the students?
Sure, and I want to also thank Dr. Reines. I hope that I'm pronouncing that as best as I can. For that, because I want to take this time to honor my staff and my teachers who are on, many of them are on this call, because they have diligently come to school, and knowing that many of our students can be carriers, they still come to teach. So it's super important that we do give focus on getting everybody, as many people vaccinated, so that they too can be safe, and we can continue to honor our teachers in the proper way. So the answer to vaccination at school, yes, you can. Please come to our, we have an upcoming event on February 5th. We have a superhero, be a superhero. And it's a vaccination event. And I want to give really the credit to our community, because we've had so many partners, many of whom have given time, resources, finances to ensuring that the Indian Creek community specifically will receive the benefits of vaccination. It will help us to not only be safe, but this is one of the first events in the nation that will provide support for our diverse community as diverse as ours. So that superhero event will be on February 5th, which is a Saturday. I'll be there. We actually have tutorial that day, and you have to pre-register. We will have fun and just nice. I don't know if we're doing face painting, but we have gift bags and lots of fun things for the kids. From 8:30 a.m. to 12:30 p.m. And this is exclusively for Indian Creek families, Indian Creek students and their parents and their siblings. So if you have a child who is at Indian Creek and they are also students at Freedom or Clarkson High School, they are more than welcome to come. And the beautiful thing is each person who gets a vaccination will receive a $100 gift card. So if you have 4 people in your family and 4 people get vaccinations, that will be 4 gift cards that total equal in value of $400. There will also be health information kits distributed in multiple languages that focus on Omicron, and our vaccine ambassadors who will also be registering people to receive free test kits delivered to their home if they have not already signed up for them. And feel free to come to Indian Creek. We've already signed up, I think, almost 100 people. I think today actually I counted, it was 76 when I counted. So we only have 300 slots. Please make sure that you bring your family members. And remember, this is for Indian Creek families only. Thank you.
Thank you so much for that, Dr. Principal Bibi. We would, I believe the poster said, or the flyer said that it would end at 10:30, but I was told it'd be ending at 12:30. if that's correct, for the
Oh,
superhero?
12:30, definitely 12:30. I hope.
12:30, okay, so it's
Yeah,
from,
we'll be there till 12:30, and we are taking appointments. Yes, we're doing the appointments at school thus far. It's run really well. 12:30, 8:30 to 12:30 is a 4-hour event. Yes.
all right, perfect. There's a lot for everyone to do there. Go attend 4 hours. You have plenty of time to make it, hopefully. All right, so when it comes to the vaccines, I believe Dr. Johnson mentioned that the dosage is not the same as adults, if I'm not mistaken. But would children need boosters, and how often would they need it? If they do need
Yes.
boosters.
Yes, and again, I apologize for having my video off. I keep freezing. So as I said before, children are required to have boosters very similar to that of adults, right? So initially we thought the booster, so you get your first 2 vaccines 15 days apart, and then you get a booster for adults. Initially it was 6 months, but CDC decreased that amount to 5 months for adolescents. So, 5 to 6 months later, you get a booster. Will you need a booster after that? Who knows, right? I was listening to a podcast the other day, and they were talking about, well, there's a study that came out more recently that said that 4th booster really is no more effective than the 3rd, and they didn't see an increase in immunogenicity from COVID just because you got a 4th booster. But we don't know. The variants change from time to time. We know that Pfizer is working on an Omicron variant. Someone asked the question of, well, since we are on the downslope of Omicron, why are they wasting their time on Omicron when something else may come up? But you never know how long it'll stay with us, in the long term. So, working on any improvement on the vaccines, I think is worth the effort. But yes, they will need a 3rd. After that, I anticipate that we're going to have boosters going forward, like we have flu vaccines every year. I may be wrong, but that's just seems to be the way things are going. But at least 2 in a booster to get started, and we'll see what happens in the future. Maybe Susan has more information on that.
No, that's correct at this point. Yeah. Nothing to add.
All right, thank you. Thank you so much. Reverend Kimani does have to head out, has other commitments. I just want to thank you for coming and committing your time to this. We really appreciate you and all the work you're doing.
Thank you so much. Alrighty. Have a good night.
Right. Thank you, Dr. Reinus and Johnson. And now back to Principal Bibi. I have a few questions related to, schools and the masks and like testing, which I think could be very beneficial for, some of the parents a lot of the parents who are attending this panel. The first question would be, will kids be allowed to attend school if parents choose not to vaccinate them? Or will that ever be a rule?
No, we will always, we want our babies in school. We love them. It doesn't matter. We're going to take our children, even during virtual times, we were able to, maintain contact with our boys and girls. But our boys and girls will always be welcome to Indian Creek if they are vaccinated or if they are not. We want to emphasize that it is always best practice if we can keep them safe, if we can keep our teachers safe, and that helps all of us. So we would encourage them to get vaccinated, as it may keep them from getting as sick and missing school. That's one thing we really believe in, is keeping our boys and girls in school and for our school to be healthy and our students healthy. So keeping them, the vaccine, the purpose of encouraging our parents to get our children vaccinated and for the families to get vaccinated, so we can all just maintain our best quality of life and to remain healthy.
Bring your man.
All right, thank you so much. Well, it's good to know, all your kids can still attend school.
Yeah.
Yes, we want them to learn.
We want them there on time every day. Yes.
Yes, exactly. On time. Don't forget that. All right. So what advice would, I feel like this is like open to three of you, Dr. Reines, Dr. Johnson, and Principal BV, is what advice can you give a parent to tell their child to stay safe in school? So how can their children be safe in school other than just wearing a mask? Because we know it's really hard for children to keep the masks on. So what other precautions can parents tell their kids about?
If you don't mind, I can start with what we expect in the schoolhouse. It's actually not that hard to keep your mask on. What I would like to encourage, because you have to inspect what you expect. So when our boys and girls, our teachers are great models. They remind our boys and girls to keep their masks above their noses. We've had this district provides PPE or protective equipment for our students and our teachers. And we ask our parents to send them to schools with masks. That just helps us not to exhaust our resources. If they don't have them, the district does provide masks for us. And we've even had donations of beautiful handmade masks by some women in the community. So we have layers upon layers of support in maintaining our children's health. We also wash our hands very often. We run out of paper towels quite often and soap, but we wash our hands for our lunches and our gatherings, our common areas where there are larger groups of children. We've reduced those groups in half. So for example, instead of having a full cafeteria, we've divided our lunches into A day and B day, and one group will eat in the cafeteria and one group will eat in their classrooms. And this allows us to, and when students are eating, they have to have a shield on. And that just, we don't know how effective it really is, but it just keeps them from pushing anything that may be in their mouth, because they have to have time to talk. And generally the communal time is lunch. So it just keeps them from having to spew out whatever right around them. And our teachers, again, every day, every child throughout the schoolhouse has to have that mask. So I want to encourage our parents to, one, ensure when they send their children to school that they do have their mask, and encourage them to just, to be honest, even walking home or when they are with their friends or in other spaces, to try to practice using their masks. It may help, keep them safe at home as well.
I would like to add, this is Veda, that, children model the behavior of their parents. And that's, unfortunately, what we're witnessing today in a lot of these school districts are families that are very angry and insistent that their children not adhere to that. And of course, they don't adhere to wearing masks either. But for those parents who are really concerned, given that children model their behavior, that they always wear their mask when they go out and wash their hands and reinforce that at home. And the other sort of sweet recommendation based on a really funny story is that they not exchange masks with one another. I had a colleague who sent her little one to school. I think maybe had a Hulk mask, and we came home, he had a Thor mask. And she said, "Where'd you get that from? You don't have a mask like that." She says, "Oh, I liked his better and he liked mine, so we exchanged our mask." So you don't think about things like that, but just tell the children, do not, exchange your mask with other people, because, it belongs to you, it protects you, and their mask protects them. So those are the only two things I have to add.
Yeah, and I'll just say that I love the idea of kids taking off their masks to eat and then wearing that face shield. Kids do need to communicate. They do need to chat with each other. So I think that is very innovative and a great idea. And I just agree that kids can get used to masks. We as physicians wear masks in our offices all day long. We've gotten used to doing it, and kids get used to it as well. I think that parents object more than the children do once they get used to it. Yeah.
And can I also add that we've had very supportive, overwhelmingly supportive parents. They do make sure, even when they come up, some, for the outdoor portions, it's very difficult to have crowd control because I have 900 plus, about 900 kids. So many of them also come on campus with a mask, and I want to thank them as well for being a part of our modeling for our boys and girls.
Thank you all for being great models to all of us. Yeah, I just want to say, like, we all got so used to wearing masks that now just walking into certain buildings, I find it, I don't even remember what it looks like when people don't have masks on. Like, especially at the hospital, like going before, it was like you'd have like certain nurses, like not everyone's covering their faces, but now it's like everyone has it. But yeah, kids definitely, like, we got used to it. They just put it on and they'll complain here and there, but once you tell them it's for your safety, they keep it on. But speaking of masks, right now there's a lot of confusion about what mask to wear, the best masks for maximum protection. There's the cloth masks. Some people do just wear like the face shield without masks. There's like the surgical ones, N95. So no one really knows what to wear. Some just double up the cloth masks. Yes, if you give us a little insight on that, Dr. Reines and Johnson.
Sure. So I heard Dr. Walensky, who is the current head of the CDC, in an interview recently, and she made, I think, a very intelligent statement, and that is that the best mask is the one that will be worn correctly and that somebody can keep on throughout the day. So I think that that's really important. So the very best masks are going to be the N95s and the KN95s. But those masks are not going to be so comfortable for everybody to wear for long periods of time. And I can attest to that. Surgical masks are probably going to be next if people can get a hold of surgical masks. And from personal experience, surgical masks are quite comfortable to wear all through the day. And I think all of these are going to be better than cloth masks. But a parent recently said to me that she was told that cloth masks are useless. And I disagreed strongly with her. And I said, if that is the best mask that you can get, and if that is the only one that your child is going to be willing to wear, then they should wear a cloth mask. So that's my opinion about masks. I think shields work well in addition to a mask, but shields should not be used alone.
I agree, and they're more difficult to come by. But it's to sort of rephrase what Susan just said, any mask is better than no mask. Let's put it that way. We do find, though, that if you have the surgical mask and you can cover it with a cloth mask, you can get close to the protection of an N95. But again, sometimes the cloth mask, and I have so many masks. They're everywhere. I have 4 or 5 in my car. I have them in my purse. I have them in my lab jacket. I have them everywhere. And I do find that certain cloth masks can be somewhat restrictive and difficult to breathe a little bit, so long as it's well-fitting and it offers you some protection and you actually cover your nose, for God's sakes, then it can be very protective. Even though you don't have the most protective, which is the N95, which is really, it gets really uncomfortable after about 3 hours, I have to admit.
Yes, and how about, so I have a cloth mask, and I've seen some people have it too, where there's a little pocket where you can put a filter in there. So I know that some people have been doing that instead, and then they wear like the surgical mask, and then they wear the cloth mask that has a filter in it. So does that also work?
Yeah, absolutely. If you can tolerate that. Sometimes that becomes a little restrictive. I have a lot of masks, cloth masks that have filters in them. I've gotten presents, I buy them, but like I say, I think that the cloth mask with the filter, if you don't have a surgical mask, is better than just a regular cloth mask.
Okay. All right. Perfect. Thank you. Thank you so much. And now I just want to know if both of you have had any like questions or concerns about the COVID vaccine that you've been hearing from families, right? From your patients or like at the hospital. Are there any questions that we haven't discussed so far?
Well, for me, it's just a lot of the questions are grounded on misinformation. And so I spend a bulk of my time listening and then getting permission to express my perspective on, why I think vaccinations are important. We really struggle as pediatricians with vaccine hesitancy. And like I said, it's not only for COVID, it's for a vast majority of, it's for a large number of other vaccines as well. It's a growing movement in this country. And I think it's fueled by social media and internet and whoever else they're listening to. And so it's been a real challenge for us. But, like I found though, that if I listen to my parents and I, appreciate what their fears are, and some of them are genuine fears, and some of it is clearly based on misinformation, but some of it is just, I take care of a large African-American population who's very leery of the medical profession. Everybody wants to bring up Tuskegee whenever I talk about anything, and I have to clarify that for them. But I think, just listening to their concerns, respecting their position, and then allowing and asking them to give us opportunity to express our position has really helped me tremendously. Parents know that I respect them. They respect me. And so some come in prepared for a fight, and then they leave with, okay, let's think about this a little closer. I think the thing that bothers me the most, and I'm going to have to tell you this, is when people say I have to do more research. And I go, what are you researching? What study are you looking at that I haven't seen? But people like to use that. But again, some people have genuine concerns, and I am very attentive and attuned to that, and I respect that. But I do try to express my position and try to convince them that this is in the best interest of not only their children, but like Susan said, everyone in their family, their neighbors, their teachers, all those that children come around.
Yeah, I will sometimes hear from parents that the vaccine is too new. We just don't have enough information about this technology. And the technology has actually been around for well over a decade. This is the first time that we have a vaccine that has been used on so many people, but the technology of mRNA has been used for cancer chemotherapy. I believe that there was some work done with a possible Ebola vaccine several years ago, but the technology is not new. They were just waiting for the right time to create a vaccine that could be used in so many people. So I think that that's an important one. And like Veda said, I hear a lot of, I'm not sure, I need to do more research. And I try to ask people what are their concerns. And it does take a lot of time for a provider to sit with a family and try to, tease out what are the main concerns. But the time is well spent, and I do try to do it. No parent has yet said that they're sorry that they've gotten their kids vaccinated.
Absolutely.
That's a good way to end it. No one has regretted it. So that's right. A good sign. That's a good sign, because I've asked, I did my own little research by asking just parents in my circle about why they're resisting vaccinating their kids. And a lot of it is our kids are, they're just starting their life and we don't know if there are any long-term effects. So we want to wait till more kids get vaccinated to see if there are any like long-term impacts on it. So it's the same argument that, and this, I'll say concern that adults had at the start when the vaccine was first being rolled out, and that just being reiterated with the kids. And, parents have, I believe, every single right to be concerned about their children. Right. There is a lot of information out there and a lot of misinformation. So just believe people need to, it's very important to speak to doctors about it, qualified individuals who know about the research. And the research I'm doing is not being funded. It's not billions. It's not worth billions of dollars. So just put that out there. But yeah, I want to Thank you for sharing that. I hope that was very beneficial to many of you. One question we did get is about the free test kits. And actually, hold on. There's one question about the vaccine. So if a child tests positive for COVID, how long should they wait to get vaccinated? I don't think we.
So I actually did mention that, but I'll be happy to say that again. And that is, once they've completed their isolation, so I would wait 10 days, and as long as they're free of any symptoms, and they weren't hospitalized with COVID, because that puts them into a different category, they can get the vaccine after completion of isolation.
All right. Okay, perfect. And then their antibodies, because I know there's a whole, that their antibodies will protect them for 3-6 months. They should still get vaccinated regardless.
They should still get vaccinated, yes. Correct.
All right, perfect. Thank you. So now just moving on to the free test kits, getting questions about the free test kits. Wow, tongue twister for me. But you can request them online. I believe we do have a slide showing that, so it will pop up. Yeah, so there's just like different locations where you can, where parents can get their children vaccinated, and also where they can get the tests. Is somewhere on there. There's also a QR code too that they can access. But now I just want to thank you all for attending, and thank you, Dr. Reines and Dr. Johnson and Principal Phoebe for answering all of the questions. I hope it didn't tire you all. I didn't see anyone drinking water yet, so. Right now I'm just going to open it up to, participants, to the audience, see if they have any questions, if they want to share their experiences when it comes to, either their kids getting COVID or their concerns about vaccinating their kids. We would love to hear from you. So just opening the floor to everyone now. Please feel free to just ask any questions. Right, well, you can ask any of the doctors. If there aren't any questions, I hope that's because we covered everything. That we did a good job at it. Even though I just asked the questions, the professionals answered. I just want to thank you all for attending, and just one last round. Nobody has any questions to ask. Don't hesitate at all. And you can just type it out. You don't have to say it out loud.
Would it be okay if, okay, go ahead.
Hi, this is Suad, graduate research assistant working on the COVID supplement grant. I just wanted to say, with the Omicron, I think almost everyone that I know got COVID, over the holidays. There's still people that I meet today that have actually gotten it. And I think it's really important for people to realize that this is extremely contagious. And if you can get your child protected by getting the vaccine and protecting your loved ones, I think it's really, really important. Don't hesitate on getting the booster, because I have a lot of people that I know as well that say, well, I've gotten both shots. I'm okay with not getting the booster, because they think they're still getting some level of protection. And I think both Dr. Susan and Dr. Veda can say that obviously once your 6 months has passed, it's always best to go ahead and get your booster. So just kind of wanted to reiterate that. We know a lot of people who have had different reactions. Some are symptomatic, some are asymptomatic. I was definitely symptomatic, and I felt really, really ill over the holidays, and I was in bed for about a week. So that was no joke. And I definitely went ahead and got my booster shot today at the International Community School. And if you guys can come out to the Indian Creek Elementary vaccine event, please do so. Save everyone, save your community, and get vaccinated. So just wanted to put that out there.
That's great. It looks like there's another question. If you got the vaccine and then got COVID, how long should you wait to get the booster after testing negative? So the booster is recommended 5 months after the second vaccine. And if you had COVID in between, as long as you've completed the isolation requirements and you're free of any COVID symptoms, it's okay to get it 5 months after the second dose.
And one question about the booster is that what makes the booster different from the other 2 doses, and how can that combat Omicron, since that's what, you know, what came out around the same time, and they're saying, you know, take it, get the booster to prevent any, like, you know, just getting infected from COVID. So what makes it different from?
Yeah. The booster is just a 3rd dose of the same vaccine that you received. There is some interchangeability between the mRNA vaccines. So if you got 2 Pfizer vaccines, you could boost with either a Pfizer or Moderna vaccine. If you receive 2 Moderna vaccines, you can boost with a Pfizer vaccine. And the idea of the booster is just to boost your level of antibodies in your blood so that you have more capacity to fight that infection when your body is confronted with it. So higher levels of antibody will be more protective.
Absolutely. So remember, with childhood vaccines, we boost them all the time, right? We give the same vaccines to babies at 2, 4, 6 months of age, and then later on, either 15 or 18 months of age, and then at 4. And so, like she said, boosters are exactly what they do. They boost. They elevate the level of antibodies circulating so that they can combat the virus when you're exposed to it.
Thank you so much for sharing that. One last question would be if a parent is vaccinated and they get COVID, are they able to pass it on to their children to infect their
Yes.
child?
Yes.
Okay.
Simple answer.
Absolutely. Yes.
Okay, perfect. And if they're asymptomatic too, they could also
Yes.
infect their children. All right.
And that's why so many people are infected, because asymptomatic individuals can pass it on just as easily as symptomatic individuals.
All right, perfect. So children can get infected through that if they're not there's a high chance of them not getting infected if they have the vaccine. Would you say that?
So there are many breakthrough infections. So the vaccine is somewhat protective, but there are many breakthrough infections with the Omicron strain. And so the vaccine is preventing more severe disease and hospitalization. It is not going to be 100% or anywhere near that in terms of preventing infection, you know, a mild infection or asymptomatic infection. So we shouldn't have that expectation from the vaccine. The vaccine at this point is preventing severe disease and is 90% effective still at preventing severe disease.
Right, perfect. Thank you for sharing that, because I've heard a lot of, I guess I'd say arguments, especially on the internet, where it's like, why would you get vaccinated if you're still going to get sick? Right, and there's a lot of, why would we vaccinate a child if a child already had it or will have it when they get vaccinated? So thank you so much for covering that. And thank you, Dr. Johnson, also for giving your input. So it seems like we are nearing the end of the panel discussion, and there are no more questions in the chats. I believe we covered it all. So I just want to thank, does anyone have anything to say? Principal Vivi, do you have something to say?
Khadija, I just want to thank you.
Of course.
Thank you for moderating. Thank you for keeping all of this together. We appreciate you. And thank you also for the panelists. Thank you so much for helping our beautiful school and our staff and our families.
And thank you to the teachers. Thank you to the teachers and the principal. You guys are amazing.
Absolutely.
And the
Thank
kids
Thank you
need
so
you.
much
The
for the
kids need
panel.
you.
Thank you. Thank you.
Yes, they do. And I just want to say thank you all. Just put in the chat. I just want to read it out. Is that thanks PRC saying, thank you everyone for attending the virtual provider panel. We appreciate all of you and look forward to seeing you at the Indian Creek Elementary Vaccine event on February 5th from 8:30 to 12:30. It's a superhero vaccine event. Show up. It'll be fun. There is, there is an incentive there. If I was part of that community, I would go. But yeah,
I
get
know.
vaccinated, wear a mask. I get vaccinated. It looks like it'll be fun. But yeah, so thank you all for coming. And hope you
And
all
invite a friend to, if you're on the call, make sure you invite a friend or 2 or 3 to come and sign up and register at Indian Creek. You have to register at Indian Creek. Thank you.
all right.
Thank you so much. Thank you so much for the panels. You guys have answered a lot of some of the most common questions being asked out there. Why should I get a vaccine if I can still get the COVID and so forth? I just wanted to finalize and ask another last question, maybe if I may, is if it's airborne, for Omicron being the most common now and the widest spreading virus at this juncture, do we recommend for pre-existing conditions who are on the elderly to be wearing the NK5? Anybody can answer that?
Yes. Can you repeat that question, Khadija? I didn't hear it very well.
I said, thank you very much for the
Oh.
panel. Most of the questions you guys that we get exposed to the community, you've answered them. I was just curious is if somebody has some existing, an elderly who have some existing conditions, and this being an airborne disease, do you recommend them to be having the N95 and so forth?
Absolutely, an N95 or a KN95 if they can get their hands on it. And I believe now that some of the local pharmacies are going to provide masks free of charge, up to 3 masks per person. Walgreens, CVS, and that's our president is making that available. So yes, a high quality mask, N95 or KN95. And you have to be careful when you order some of these online. Some of these are counterfeit. There have been some good articles from the New York Times telling people how to tell the difference between counterfeit masks and masks that are higher quality.
I just want to add, just make sure that they can tolerate it. That's the only thing. I think they should if they can, but sometimes it can be it can really restrict your breathing. So if you have pre-existing or you're oxygen dependent or any other thing that would prohibit you, don't feel as though you can't go out wearing other masks. But as long as you can tolerate it, I think it's best that you use the N95.
Thank you so much for that info. Thank you.
Mm-hmm.
Thank you, Mohammed, for asking that question, and thanks to the panelists for answering and clarifying that. If anybody else has any questions, this is your last chance. Anybody? No? All right. Going once, going twice. All right. It seems like we have definitely reached the end. It's like 7:27. And we're supposed to be ending at 7:30. So again, I just want to thank you all for coming. Thanks to the panelists. You guys did an amazing job. We wouldn't have done this without you, literally. And without everyone attending, thank you. I appreciate you all taking time out of your day for this, for attending it, for asking your questions. And I hope you all attend the Indian Creek vaccine event.
Thanks for having us. We really enjoyed it.
Yes, thank you so much.
Yeah.
Bye-bye.
Bye, guys.
Thank you and
Bye-bye.
good night.
Good night.
Good night.